most famous physical therapist on the internet.
Hi, folks. I'm Bob Schupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Your sciatic pain may never improve if you don't do these 3 simple tests for piriformis syndrome.
Because, yes.
If you have, in other words, what we're saying is if you have piriformis syndrome and you're thinking you have a herniated disc and you're treating that, the piriformis syndrome is not going to get better and your pain's not going to get better.
And their symptoms are almost identical.
Right. So we're going to show you 3 tests, basically.
Right. You can do this at home, and you can treat it at home as well, which we're going to show you in another video. But before all this happens...
Yeah, at the end of the video, we're going to show you what our giveaway is. But if you're interested in our giveaway, you want to go to our channel website, bobandbrad.com, and go to the giveaway section. It'll also be pinned to the top of the page on Facebook. If you want a short version of us, go to Twitter, Instagram, or TikTok. Make sure you subscribe to us.
Yeah, that would be nice. We appreciate it.
Yeah, we'll send some good vibes your way.
We'll help you out forever. Okay, Bob, piriformis syndrome or sciatica, we're talking about the pain that starts in the back, runs down off into the butt, all the way down the leg and into the foot. And, you know, it can vary depending on how serious it is, but piriformis syndrome does very similar symptoms. So, like you said, if you're treating your sciatica as if it's a disc, things will never improve if it's a piriformis.
Am I correct in saying sometimes you might not have back pain with piriformis syndrome.
Right.
You might just have pain starting from the buttock going down.
Sometimes it happens with the back too, though.
Yes, sometimes it does.
Yeah.
It's difficult.
Should we show people what piriformis, what it is?
Sure.
Okay, let's use Sam. Sam, I am.
Here's your pen, Brad.
Oh, the pen, yes. Okay, so let's look at the anatomy a little bit. The piriformis is actually a muscle, and it's...
A small muscle.
Yep, it's in your buttock. We got one on each side, but here we have the green tape representing the piriformis muscle. It starts at the sacrum, and it goes over to the greater trochanter.
Which is the hip.
The hip, yep. So from here to here, and this yellow band actually represents the sciatic nerve.
Yes.
And it goes, as you can see, underneath the piriformis muscle. And if this piriformis muscle tightens up, it can put pressure on the sciatic nerve. There you go. Then you have that sciatic symptoms going down the leg. And so if you treat here, and this is tight muscle, stays tight, it's not going to change. But the good news is we can test this and actually treat it without a lot of complication.
Yeah, and it seems like what causes that muscle to tighten up. I had one person who was walking through mud, and I think he actually tore the muscle.
Oh.
And then it started to heal up, and it tightened down over the nerve.
Right.
And it also, just even from doing a lot of sitting, can cause problems to that muscle.
Exactly. That is one of the common irritators of piriformis symptoms is sitting.
Yeah.
Which is the same thing for disc.
Yeah, and you can also, if you're sitting uneven, you know, you sit on one buttock a little more than the other buttock, which a lot of people do. I tend to do it.
Yep.
It can give you problems.
So if it's just this muscle becoming tight, and what we're going to do is stretch it, and we're going to do some other treatment to get it to loosen up, and then you have no pain.
And that's in our next video. Today we're going to show you how to maybe tell whether or not you have it.
Exactly right. So first we test for it, confirm that you have it, and then wait just a few more days and we'll have the next video out to treat it.
Sure.
Can I put the pen away, Bob?
Yeah, put the pen away, Brad.
Did I use it?
I don't know if you did.
Okay. So here we go.
I was going to let you,
Here's the first test. You have to do it laying down. Lying down? Lying down. Sorry.
Well done, Brad.
All right. So you can do this on your bed. It might be better on a firm surface, maybe on a carpeted floor. Let's say the right leg is the one that has the sciatic symptoms. We're going to do that one second. So first test the good leg. Take the knee, and this is called the fair test in the physical therapy world. We're going to flex, abduct, and internally rotate it. So basically, just grab your knee, pull it up to your opposite shoulder. Typically, works really well. You're going to feel in your buttock there, you should just feel a stretch. Nothing too unusual. And then you compare this side, then you go to the painful side. typically with my patients, and you can talk about your
Yes.
experience, they say, "Oh, it hurts right down
They
in
can
here."
tell right away. They can tell the difference between the two.
Exactly. They're not the same.
Yeah, and if this is sciatica from a herniated disc, it shouldn't make it worse.
Right.
I mean, because you're not putting pressure on the sciatic nerve really.
Right.
This stretches the sciatic nerve.
There you go.
And
The
you
straight
this
leg
put-
raise.
Yeah,
test.
this kind of puts slack on it.
Yep.
So this is putting stretch on the muscle itself.
Right.
So it's a good indicator.
Right.
And I would say, Brad, almost 90% of the time they say, I mean,
Yeah.
it's very evident.
different. But wait, there's more, Bob.
There's more.
You can do 2 more tests. That's the first
Sure.
one. It's a very easy one. The next one is right on this area. You can just actually palpate in. If you remember, Sam, where the piriformis is, that greater trochanter, if you go like this
Yep,
with your leg,
Twist your leg.
yep, you can feel that bone moving, and that's your greater trochanter. Go up a few inches right in here. And I usually do this laying down.
Or lying down.
Lying down, and you're going to palpate in there. And that means push in deep, because that's a deep muscle. We're going to go in there, and first of all, again, check the side that has no pain. Push around in there, and you'll feel how a normal side feels. Go to the sore side, and typically there will be an area about this big that is really tender, and it's like, oh, wow. And then there's a way to treat that, but we'll show that on the next video. Now, if the first one and this one are both positive, that's a pretty strong sign you have it.
You're starting to believe that you might have it.
Right. But wait, Bob, there's more.
Still one more.
One more. So the next one, and then you just go from doing that into a press up. Now, if you do this 5 to 10 times and nothing changes with that, it's a good sign that it's not your disc,
Right.
and it may be your piriformis. However, if you do this 10 times and the leg pain actually improves, well, then you might have a disc problem.
Sure.
It's possible you have both.
Yep.
I don't know what the likelihood of piriformis syndrome and sciatic from a disc is,
I
but
haven't seen
it's
that either.
possible.
I can show you one more, Brad.
Oh, a bonus.
I'm going to give you a bonus.
Yep.
You can lie down and you can actually put your leg, your knee,
Oh.
to the other knee, and you lift it up like this.
Oh, the
And
old
that's-
roadkill.
And that's actually making that piriformis muscle work really hard.
Right. So right here is that piriformis muscle.
So if that hurts and it sends pain down your leg,
Yeah.
another sign,
Yep.
another possibility sign.
Yep.
So let's talk about the giveaway of this week, Brad.
That is a good point, Bob. What is it?
For those of you who want to work out at home, we have an excellent system. We have the wall anchor.
Oh.
You want to show Brad what that looks like?
Yeah.
It does involve, unfortunately, that you have to put something on your wall. So if you're in an apartment, I'm sorry, we'll have to give you something else to do.
Unless you ask your landlord.
Yeah, right.
You might be in good terms with them. I
Good
don't know.
graces, yeah. So we if you go to our website, and we'll put a link down below, you actually get 4 of these, and you can put up. Well, come over here, Brad.
Yeah, come over here. Mike,
got-
follow us.
We got set up 2 here, 1 here, and 1 below, and this allows you to perform exercises at all levels. Then, so
Sure.
we're giving away a bunch of these, and if you buy from our website, you get 4. If you buy from Amazon, you get 3.
So for the same price.
For the same price. Actually, it's cheaper, I think, on our website. We have actually a little.
Yeah,
bit of
we're giving a
discount.
heck of a deal. It's a
But
good
you can
system.
do a myriad of exercises. You can do every exercise. You can exercise every muscle in the body.
You can, literally.
And what's nice about these is they can be changed real fast, and you can actually put on 2 bands. There's a bunch of ways you can actually use it. You can actually go through the center
Yeah,
like this.
let's get this out of the way
Yeah.
so people can see.
You can go through the center. See how I folded that in half? I put 1 on top. I put 1 on bottom. And now, when it's like this, it actually won't slip. So now I can go like this, and it won't slide through, which, like this one does right now. If you go, it'll slide
Right.
like this. And that's what normally you will find on
Right.
bands.
You'll find what they give you with bands is a device that fits into a door, and you're
Right.
stuck to doing all your exercises on the door, and you don't have near the flexibility that these offer. Oh yeah,
Yeah.
They work for boxing,
That's right.
punching as well.
So anyway, I hope we did sell that too hard, Brad. But anyway, that's our giveaway.
It is.
So sign up so you can get a shot at it, and remember, if you haven't subscribed to us, make sure you do that, because otherwise we'll go out and
Yeah, we'll cry.
that's what we'll do. We'll cry. All right. Thanks for watching.